I'm going to make a motion to begin the meeting on April 24th, 2020, the Board of Health meeting. In attendance are Chris Mills, Aria Zayas, myself, Lynn LeBlanc, Kristen Kennedy, Mark Myers, and Tim Mark Taylor and Tim Myers, excuse me.
Thank you.
Sorry. It's like you're twins.
Oh,
Okay, so I just want to, in keeping with the ongoing emergency order, are we going to read that again? Yeah.
Yep.
Yes.
Yes.
Okay, in keeping with the ongoing emergency order from Governor Charlie Baker to limit gatherings and maximize social distancing, and under legislation passed to address remote board meetings during the declaration, this meeting will be conducted over Zoom. Attendance by the board members will be remote, and remote attendance shall count toward quorum. The meeting will be broadcast live and recorded on ECAT. To join a remote meeting using your computer, click on the URL at the top of the meeting agenda, or copy and paste it into your browser. To join a remote meeting using your phone, call the number provided underneath the URL. You will be needing the meeting ID to join by phone only. Okay. So there are no minutes to go to accept, so we're going to go right into our variance. So this variance was something we discussed at the last meeting, but because it wasn't placed on the agenda before that 48-hour time frame, we need to revisit it and reaffirm the variance vote. Is that correct?
Correct.
Okay, so it is 290 Turnpike Street, a variance request for J.K. Holmgren Engineering for 290 Turnpike Street per the letter dated February 25th, 2020, submitted by J.K. Holmgren Engineering. Does anyone need to be reminded what that was about, or can we vote to reaffirm?
I make a motion to approve the variance request for J.K. Holmgren Engineering for 290 Turnpike Street per the letter dated February 25th, 2020, submitted by J.K. Holmgren Engineering. Chris?
second.
LeBlanc, third, all those in favor?
It has to be by roll call, Lynn. So I suggest we go alphabetically backwards if we start with Aria.
Zayas, aye.
Mills, aye.
LeBlanc, aye.
There you go.
All right. So we just do that at the end.
Mm-hmm.
I still don't have the hang of that. Okay, so the next action discussion is the discussion and possible vote on the order to wear face coverings while in essential businesses in Easton. Now, do we want this, the whole declaration read, or
I don't,
people?
if you want to, let's go through the rationale for it, why we are bringing it to you for a vote. And then I would say as part of the motion, possibly, in case there are parts of it that you do want to change or disagree with or alter. So the reason that I'm bringing this to your attention is that we have received, as you know, we were very proactive as this pandemic began, and the town geared up, in addition to our normal methods of accepting complaints and fielding questions through the Board of Health office, the town geared up a COVID-19 phone and a COVID-19 email address for general complaints from the public. There have, in the past few weeks, been a number of complaints received regarding issues surrounding face coverings. Since the governor came out on earlier this month, and since the CDC adjusted its thinking earlier this month, and both have recommended cloth face coverings to slow the spread of COVID-19, it's become something that a lot of people, well-meaning people, are doing and are doing properly. It is also an area where some people are not taking it as a necessity, because it's been a recommendation from the governor and from CDC. So what we're looking to do is move to a state where under the emergency declaration that the board made back in March, because of what we are observing in our community, you would be taking the step to order people to wear a cloth face covering in certain circumstances. This is not everywhere. This is not when you walk your dog. This is not when you're out in your backyard gardening or even going for a walk. This is specific to when members of the public are entering essential businesses, as the governor has defined them. And this is where we're seeing most of our complaints, is in the grocery stores, in the smaller pharmacies, the convenience stores, the smaller businesses where people entering, as well as number two being the employees, are not wearing face coverings. We have had some complaints as to businesses that are considered essential but are not public facing. So those would be offices, manufacturing, things like that, where the governor, there was some latitude given as far as, again, the social distancing. And if they're able to provide social distancing, they're fine. But there are scenarios, and we have fielded complaints and had to do a few investigations centered around work situations where masks are not being worn and 6 feet is not able to be accommodated. I do have to say, Tim did a very thorough, we all talked about it. We all came up with a strategy. And Tim did the actual investigation with one of our local manufacturing firms. And I have to say, I was incredibly impressed with the amount of information they were providing to their employees, how very early on they were getting information out, some of the accommodations and things that they had thought through in setting up second break areas so that people, and removing chairs so that people couldn't congregate in groups. So, I mean, we have a lot of businesses out there as well as a lot of residents that are consistently trying to do the right thing to stop this. But this will give us a tool to be able to frame the conversation in a way that it's not an option anymore. If you are going to be entering or working in one of these forward-facing businesses, or you're working in one of a business situation or an office situation where you can't have the 6 foot separation, you are going to be ordered and expected to wear a face mask. The fourth area where we would be requiring the face masks would be in residential and commercial buildings that have more than one unit. And by this, if you think about some of the doctor's offices that are set up basically like doctor condos, there's a common staircase, a common elevator, maybe even a common lab. Those common areas are very hard for people to maintain social distancing. The staircases aren't 6 feet wide. The hallways aren't 6 feet wide. So we would be requiring people to wear masks there, as well as in the similar residential situations. So we have in town residential facilities where there's a common mailbox area or there's a common laundry facility. And in those areas, the expectation and the order would be for residents to wear a cloth face covering. You'll notice I keep saying cloth face covering, and it's spelled out in your potential order as well, that these facial coverings don't need to be of a commercial grade. They do not need to be N95s that we've all heard so much about. We really do want to stress that those supply chains should be reserved for our frontline medical professionals and first responders. That this is speaking towards using cloth face coverings that people can either make at home. I mean, a lot of us have surgical masks in our home that we did procedure masks. So they're out there. They were available on Amazon. But there's also a lot of other ways to accomplish this without having to go out, spend money, and do something commercially. We are going to be requiring in this order that all customer-facing businesses provide signage to remind people. And as with anything that we do, our mentality, our thought process, our way of going about these types of things is always first and foremost from an educational standpoint. So the plan for getting this rolled out would be that we would notify all of our permit holders that this might impact via our online permitting system, again, to educate them, let them know what's coming. We would also be adding information to our webpage that links to some very good documents that the CDC has up, explaining why they're recommending the face coverings now. And also the document we're going to be posting shows how to make 3 different types of cloth face coverings in a DIY scenario. And there's some videos that go along with them. One is, it does involve sewing. I sew and I still haven't sewed any. One involves cutting up a t-shirt. I've seen some on Instagram that involve cutting up a sock. The one that my family tends to go to, because we actually have a bin of bandanas. And by simply folding a bandana, taking 2 ponytail holders, and this will be on the video. I didn't make this up. This is on the CDC website. 2 elastic bands looped around, folded upon itself.
Nice.
I've got a face mask that I can throw in the washing machine every time I do a load of laundry. And I'm actually breathing through like 12 layers of fabric right now. So I actually have a good amount of protection. It wraps very well on the sides, which is one of the criteria that they're looking for. And by adjusting where the elastics are, I can get this pretty taut across my face. Minute I get in my car, it comes off because it's hot. But it is easy enough to do at very little expense. Any piece of fabric, a couple of elastics, and anybody at home can make one. And those directions will also be up on our website. I think that is it for my explanation as to why this is in front of you. What our plan is again, first and foremost, education, promoting this information. Our admin kit has put together a model sign. The plan would be that our inspectors would go out the beginning of next week after all the businesses have been notified, after we've done some outreach in the community, and then just speak to our local establishments, provide them with signage if they need it, provide them with any other support that they may need, and go from there.
It's interesting because I liken it to the signs you see, no shoes, no shirts, no service in restaurants and stuff, on steroids because of the pandemic, interesting.
So, Kristen, I wonder how this is enforceable.
It is enforceable in that we're giving everybody the tools. Town council, we did go through whether or not there should be a fine. I don't think that is, and the sense I get from the board is that's not our intention. Our intention is to really draw attention to this and to, unfortunately, it's unfortunate that we have the need to actually make this an order and make it something that isn't about choice anymore, because choices people are making are impacting people who are not able to protect themselves. We've got staff working in some of these facilities that may be wearing a mask, but are also then being approached by customers who aren't wearing masks. So it is a common courtesy type of thing. I think a comment that Chris had made at one point. And it is enforceable. We haven't put any fees or fines or anything in here, and that's kind of intentional. It is more to draw our attention and to give us the ability to have the expectation that they're going to comply. I don't anticipate, based on how cooperative most of the steps that our businesses have taken, as far as installing plastic at the checkouts, doing the counts on the grocery stores. As we went out to inform our grocery stores about the requirements for limiting the number of people in their stores, Mark and Tim, you can speak to it. You were met by companies that had already taken great steps. The first time we went out looking for people for them to have wipes and plans in place at the doors, they're already doing these things. This actually gives them a tool, because now they can step up to that customer and say, you can't come in without a mask. And it's not me saying it, it's the Board of Health saying it. So it actually is giving them a little bit more of a tool to use as well, and just to further the protection of the community.
So it would look like if say a person went into, I don't know, I don't even know if some of the restaurants are allowing you to walk in to do takeout or if it's all curbside. But it would allow a business, whether it be a grocery store or a community store or a restaurant, if somebody comes in and they're coughing or, you know, whatever, they can say, hey, listen, you need to have your mouth covered.
No matter what, they would need to have their mouth covered. They can actually point at, tell them, stop at the door, where's your mask, go get one, and then come back and get your takeout.
Okay.
Same with the markets. They're counting people now as they come in. They generally have a person at the door anyway, or in very close proximity to the door, and they would be able to say, excuse me, can you please return to your car and get your face covering?
Okay.
You need to come back with something covering your face.
So this,
I mean, we know there's circumstances, and Chris, I think, you know, you've seen firsthand some circumstances where, you know, we don't know what's going to happen on a given day, and we plan on staying away from people, but situations arise when we're out that we as human beings feel the need to interact, whether it's somebody having a medical emergency or somebody falling or a child about to fall. Our instincts take over to help.
right.
And if we're unprotected, we're not helping as much as we think we are.
It's funny you say that because, you know, a few weeks ago when everything started and we really didn't have many rules in place or anything yet, I was putting a mask up inside of my hat, and my wife said, I wasn't even wearing one yet. My wife was like, "Why?" I'm like, "My luck, someone will drop dead right in front of me, and I'll want to help." I think it's a great rule. I'm nervous about making it you know, a law. I understand it's enforced, but it's not. And I guess I just want to make sure that there's enough info for the public to show that you can make your own mask affordably and cheaply, because that's just the only thing that scares me is we put out this order, of which I am in support of, but I feel it's, and I think it's necessary. I really do. As a healthcare professional, we just, and I bet you tomorrow you drive through town, it's a beautiful day. You're going to see things that you're probably, everyone is, they're like refugees at the gate trying to get out now, you know, I mean, myself included. And I just want to make sure that if we vote for this, that there's enough education. Here's how you can make one yourself if you can't afford one or if you can't find one. And like you said, it doesn't need to be surgical. It doesn't need to be N95. It can be a bandana.
Mhm.
Just something to stop droplets. I mean, everyone's going to look like they just robbed a stagecoach. That's okay. It just, you know, it's a really good idea until, you know, everybody gets their arms around this thing. It's not going to be forever, but
Nope.
I just, and it's funny because you just educated me. I didn't realize it. Okay, it doesn't have to be surgical. It doesn't have to be N95. So that's just like, I hope there's a way we can really get that out there if we, you know, vote to approve this. That's all, because I just think people will be like, all right, I understand. You know, a gator, anything.
Yep, a gator. I mean, I could put elastic in my shirt and make it work, or I could put a clip at the back of this shirt and make it work.
Bring back the turtleneck.
And yes, our intention is to plaster out information out there. Like I said, CDC's got a fantastic printable and postable piece that has the sewing example, the t-shirt example where you cut a t-shirt, the one I just showed where you actually use ponytail holders. But you're right, you can just take a bandana and tie it around your face. Plus, you're still trying to maintain that 6 feet of social distancing. Our first line would be to, like I said, get all that information out there. We would plan a Facebook post at a later date We've got one of our staff who's manning the COVID-19 phone line and email list is working on an FAQ to kind of simplify it. And we would use all of the channels available to us to get that information out there through the different Facebook groups, the different postings, the school website, the town website. Our intention would be to make the information out there easily available for everybody.
That sounds great. Go ahead.
Nope, go ahead.
I was just going to say, I'd like to point out to the people that may say, why should I wear it? I'm not sick. Why should I have to wear it? I'd like to point out that having done some tracing and working with the Board of Health on talking to people that have turned out to be COVID positive, that up to 48 hours at least before you are symptomatic, you could expose somebody to it, and it could be contagious. So I think we have to have that mindset. We really don't know if we have it. We don't know who has it, and that's why we're taking these steps.
I could not concur more. As a paramedic serving this town, I have taken several people to the hospital for non-COVID things. Let's just say chest pain. So no flu, like anything like that. And it turns out, you know, we fill out exposure reports and everything like that. And it turns out I get a call from our infection control guy on the fire department who's phenomenal. And, well, Chris, they were positive. Like and fortunately for us, we have policies in place that we're always wearing at a minimum mask, goggles, gloves. So, and when we're interacting with a patient, whether it's a twisted toe or chest pain or flu, like they get a mask before they get anything else. But I just wanted to concur with Lynn that I don't think the public realizes that one of us could have it right now, and we're just having a meeting, and you just you don't know you have it, and you might not care about yourself, but you might give it to someone you kind of like, and you know, so it's serious. I wish I could take a camera with me to walk through the ER and to see what you're seeing, and it's like out of a movie. It's scary. So
one of the other things that is important to note too is there was a article published. I think it was either it all bleeds together right now. Earlier this week, late last week, that spoke to a small cluster of people at the Pine Street Inn in Boston that were showing symptoms and were tested as positive. And they very quickly decided to go through and test the entire population at the Pine Street Inn. It's a homeless shelter. These are not people who readily access healthcare. These are not people who have, you know, vegetable heavy and wonderful food like we do. These are people who are, you know, vulnerable in a lot of different ways. And of the 300, I'm hoping I'm getting these numbers right. If not, I know I'm in the right ballpark. Of the 398 or 97 or so people that they tested, over 140 of them came back positive, and not a single one of them had a symptom. And our symptom base has expanded so far as we've gone through this in the past 2 months. You know, initially we were looking at a fever with a cough. Now we've got everything from diarrhea, sore throat, loss of sense of taste and smell. The fever is still in there. The cough is still in there. The body aches are in there. Lynn has been helping, as have some of our other school nurses, with some of the case follow-ups and the tracing, and the range of symptoms of, you know, one from this column, one from this column, right down to no symptoms that are coming back positive, really has a lot of us scratching our heads. And now I'm, you know, seeing on the news today that there's potentially some COVID toe thing going on with teenagers, where they're just getting little bubbly marks on their toes and testing positive for COVID. So there is no way to look at something. And I think the governor said the other day, somebody has the flu, you know, they've got the flu. I can remember my pediatrician looking at my kids and saying, they've got the flu. They've got that look. This thing doesn't have a look. This thing doesn't have a typical presentation. This thing is all over the place.
And if we weren't, I agree with everything you said and what Chris said, but if we weren't in a pandemic, people wouldn't have gone and checked. Because some of the people have symptoms that are just so minor that they can attribute to allergies, or I ate something that upset my stomach, that they would never even regularly get tested or think much of it. So it can be that mild and you could be spreading it.
Or they're that innocuous that you're dehydrated because of diarrhea and you're not thinking. And to Chris's point, that's why you land at the ER or you're inpatient and they decide to test you because they've got you. And lo and behold, it's not food poisoning. It's not something else. It's COVID.
Kristen, I wonder, I have a question. So if there are residents in the community who don't have avail or access to masks, whether that's financial means, physical means, whatever the case may be, does the town have any PPE resources that could be for those people, for those individuals who have no other means of getting a mask?
If they don't have a t-shirt that they could sacrifice to, or a sock that they could sacrifice to, I would encourage them to reach out to our COVID-19 line and our website. I'm not saying that, as this says, the professional surgical masks and respirators are being reserved for the first responders and our medical professionals, and the supply lines. What you're seeing on the news, it's true. It's not easy to get this stuff. But we can possibly walk somebody through where they could get the resources. I know there are, I mean, this will open, I'm sure, hopefully, I'm hopeful after this, maybe we will get a call. I know there are people in our communities that are sewing them and donating them to different places. So if there's somebody out there that is hearing this and has made some and is wondering one more place to drop some of them off, I would say please reach out and get in touch with us so that we at least know where we can direct some people to.
Great, thank you.
Any other comments or questions, anybody? Are we ready to take a vote?
Actually, this is Kit. Can you hear me?
Yes,
Yeah.
you can.
Hi, I'm here not as a town employee. I'm here as a resident. So I didn't get my audio to work, so I'm just on my phone. But I do have a question. I had a chance to look at some of the other orders, and it was interesting. Almost all the towns I looked at, they use it's 2 and above where you need to have a mask. And I then looked at Everett, and Everett says 5 years and older. And to me, that just makes a little more sense, because I can't imagine trying to put a face covering or a mask on a 2.5-year-old or even a 3-year-old. So that's my first question. So I'm just wondering, does the order that is being proposed, it's the CDC recommendation of 2 years and older, is that correct?
The order being presented today, yes, mirrors the CDC recommendation, which specifically says over 2. I agree with you, Kid. I had toddlers, and they're hard to wrangle. But I do think when I stop and I think about some of the pictures I've seen of younger children sledding and out playing in the snow, that there are ways to, make it like dress up. Okay, you're gonna look like a, I don't want to say a bank robber, but we're gonna put a bandana on you. And I guess it's best effort. The other part of this is we're doing our best, and also still recommending to people that those vulnerable populations, and we generally with this have initially thought the elderly, but we are seeing that it is affecting some of our younger vulnerable people, that as much as possible, everybody should be avoiding even going to the grocery store and going to these common places. And I guess it would just boil down to best effort and awareness and that education piece as much as possible for anyone over the age of 2. And that's my thinking presenting it.
I think, I remember last August when we were first or maybe even in July, when we first presented with the triple E threats and talking about closing playgrounds at dusk and stuff. And I think once it's presented, if you don't do something, you're liable. And that being said, I would be very nervous to not piggyback on what the CDC recommends.
I
You know,
agree.
you know, if the CDC says 2, who am I to say we should make it 5, 6, or 7? I just, it's like, sorry, folks, it's not me, it's the CDC. But if we're gonna have a rule, we might as well have a rule that's got some solid backing by
It's evidence.
people
Yeah.
smarter than us. So that's just that's my own 2 cents. As a board member, I really support kind of whatever the CDC thinks, or maybe not having your 2-year-old out, but if it's necessary, and then we're going to pull it off. You have to make your best effort as a parent, but
They probably picked that age, I'm thinking, because that's the age where they can toddle away from you, that they're more independent. And I don't know, because I have not looked into this, but a 2-year-old you pretty much have under wraps. But when you're talking 3, 4, 5, they're walking around, you know, they're touching stuff. So they're sneezing without covering. So I can see why they might have said 2 and up, that's when they should start wearing it.
Yeah, I guess my point was I understand, following the CDC recommendations. As I said, I've been around 2 and 3-year-olds recently, and, they're still very much, sucking their thumb. They have pacifiers, and they would be, touching, removing the mask. I mean, that's what that's what my point is about Everett, using 5 years instead of 2. I did have one other question. Just wondering if this would also apply to, say, daycares and camps, or not.
So right now, daycares, with the exception of emergency certified daycares that are only servicing families of medical professionals and first responders, are closed through the end of June. And as of right now, camps are not going to be opening. Right now, we don't know what, camps typically don't open until school lets out. We don't know what the landscape is going to look like at that point. Right now, a camp would not be able to open right now because it would be impossible for them to meet the social distancing guidelines that are in place from the governor. It's something, again, it's an order. It's not something that is written in stone and can't be changed. It also automatically disappears when the public health emergency declaration is repealed. I can't imagine that we would be issuing camp licenses while we still had a public health emergency declaration in place.
Hi, Kristen. Sorry, I lost the audio. Can you hear me?
Mm-hmm. Yes.
Okay. Yeah, I did follow that about the camp. So that's understandable. So that's it for my questions. Just the age question, as compared to what Everett's doing, and then to what businesses this could also apply to.
Thank you, Kit. Those were good questions.
You're welcome.
Is there anybody else out there that signed in? I don't know how to tell if that happened.
Nope, I'm just showing the 9 of us that are ECAT represented, the 6 of us, and Citizen Minsky.
Citizen.
Oh, Kristen.
Yes.
Just a remark. I can easily unmute myself. I thought you were supposed to be able to do that.
And I'll talk to you Monday about how that, because we actually have to schedule it a different way. We're scheduled as a meeting, and for those protocols to be in place, we actually schedule it as a webinar.
Okay.
So we'll go through that. It's not a big deal right now.
Mm-hmm.
So in voting for or against this, we would vote, where it says, pursuant to the declaration of a state of emergency, or how would we do each item? How would that look?
I think you could make a motion to issue the order as printed in the packet. And if you wanted to read it into the record, you could, but I think since it's part of the packet, you probably could just vote it as presented,
Okay.
unless there are changes you want to make in it.
Okay, so let's start by asking, are there any items on here that the board would like to revisit or have more information or change the information? Okay, so then we can go ahead and take a vote on this. Does anybody want to make a motion?
I make a motion to approve the order to wear face coverings while in essential business. Is there more to it than that?
Could we say as per the document on April 24th, 2020?
Okay, I make a motion to approve the vote to wear face coverings while in essential businesses with the order pursuant to the declaration of an emergency by the Town of Easton Board of Health issued Easton March 16th, 2020.
Second.
All those in favor? Aye.
Dice, aye.
Mills, aye.
LeBlanc, aye. Okay. So how will this roll out to the public? Will there be an announcement?
Given that it's Friday afternoon, I think we'll move forward this weekend with giving the businesses, hopefully some information via email. I'll be coordinating with staff as tomorrow the weather does look to be nice, and we will probably be taking some time to do what we have been doing, which is being out in the public and at the parks and educating everyone about the need to stay in their family units. And as part of that, I'll discuss with staff getting the email out to our businesses. And then we would follow up on Monday with additional information we'll get some stuff up on the website over the weekend as well, and kind of do a soft rollout with this so that everything is there for people on Monday. And we'll have the inspectors out Monday at the businesses doing informational work where they can be passing out signs and they can be making sure that all the questions that need to be answered are answered, and that the stores are outfitted with signage. And that everything is up on the website to have everybody referred to.
Okay.
How about, well, I guess it wasn't, I'm going to answer my own question. God bless you. You see, where I live near Borderland, and that's a mob scene. Like tomorrow, I can only imagine what it'll be like. Sheep pasture as well and stuff like that. And I guess it's a state park. It's not indoors, but that's the mentality that spreads it is that we're outside, we're fine. And I think it's up to us to let everyone know it's not really like that. And as this warm weather comes tomorrow, I think it's going to be a great example. Yes, that may lessen the risk over time. This virus doesn't like warm, humid, but it's still pretty active right now. So as much as you want to get together with some people while we're going for a walk, you still should try and wear that face covering.
Yep, I mean, again, our messaging has been consistent throughout this, to stay with your own family unit, not to congregate. I believe conservation is going to be adding to some of their trail signage as well, kind of reinforcing this messaging, because as the weather gets better, people are, looking to get out of their houses. And while we don't really want to encourage people to go out, we know it's going to happen, and things like, face coverings help. But we can only control the town properties that we have. So as we've done in the past, when we've had nice days, Tim and Mark have gone out and provided education and just talked to people about, you know, not, you need to stay in your family group right now. It's uncomfortable. Nobody likes it. But it's what's necessary.
Mm.
And we'll just continue. I mean, to me, that's one of our biggest roles in any health initiative that we take, even as we undertake our restaurant inspections or when we're speaking to homeowners about their septic systems. We very much take on an educational role. And I think when people are educated and understand why they're being asked to do something, why they're being asked to have a septic system, that is why their septic system is up out of the ground, because it's to protect the groundwater. When we're telling restaurant owners that they have to use sanitizer because it will kill bacteria and viruses on surfaces, when we take that extra step of educating the population that we're dealing with, we have much higher success, because when people understand why they're doing something, it's a little bit easier to swallow, as uncomfortable as it is. And that's the hope with all of this. The more we talk about it, the more time we have the inspectors out in the community educating, you know, all ages. I think that, you know, that's one of our biggest roles is being out there and being the source of solid information.
Thank you.
It's been a good team effort so far by everyone.
It really has. Thank you for all you've done. I know the Board of Health's been inundated. You know, I don't even know what to say about that.
No, I mean, and it has been a complete team effort. Tim and Mark have both been out. They've both had some great suggestions that we've capitalized on the way. Kit is completely responsible for the wonderful COVID-19 website that the town has now. She was asked to build that very quickly in a day. And it's a very user-friendly, that it's a very appealing and concise, but has a ton of information built into it. So it has been a complete team effort, not to mention beyond our office. Every office has been wonderful and trying, everybody wants to do more and do their part, so.
Well, thank you. Is there anything else, guys?
I'm
No.
good.
Everybody, Tim and Mark, everything else? Anything else?
I'm good.
You want me to, I do have a few more little things to add as far as the coronavirus, the COVID-19 update, kind of specific to our town, if you guys would like. You've been receiving information from me, so there's, you know, there's a lot going on, but I did just want to touch on a few things. One is that, like I said, that Tim and Mark have been out with the grocery stores. They've been doing a lot. When we talk about our vulnerable populations, those come in a lot of different shapes and sizes. And one of the, you know, most obvious ones that we can think about and point to in town is our rehab, our 170 bed rehab that we have. And unfortunately, the enterprise is reporting today, a good number of people have lost their lives to COVID-19 that were residents at that facility. It's tragic news, but unfortunately it mirrors what's going on across the Commonwealth and then across the United States and across the globe, where we have these concentrated populations of our at-risks, these long-term care facilities, where it's very hard to stay in your family unit. You have a roommate, you have, before this was hitting, and the rehab has been, when I say, you know, as much as we had such a great experience Tim did this week dealing with the manufacturing, we have been involved with the rehab since their own individual curve started to take a sharp incline. And it was, you know, us as a community that stepped in and said, what can we do to help, based off just an increase in the number of ambulance runs that were being run from there. And we worked with them to be one of the first communities in the Commonwealth to avail ourselves and to have a facility avail itself of the National Guard testing that was put in place. And that goes back to April 3rd. We worked with them and since then have had, we just last weekend stopped doing our daily call on the weekends. So, we are having a daily communication with them, daily check-ins with them, making sure that they're being heard at the state level as it goes to the conduit for PPE that they may have through there. We're coordinating our testing. They did have the National Guard back out dropping off test kits because as I'm sure you're seeing on the news, and it's real, they are having trouble getting the swabs. So they went back to the pool for the National Guard, and the National Guard dropped off testing kits for them. And they did test a large number of people that were there that were asymptomatic, still waiting on some of those results to roll in. But the nature of the beast, they're seeing some tragic losses there. The next wave, and I've been saying this for about a week now, the next wave that we're starting to see again in these vulnerable populations that are very hard to have quarantine together or to have stay at home together are our group homes. We have a good number of group homes in town. And again, these are individuals who, are having a hard time with this whole process. And we're starting to see an uptick in the positives that we're getting there. Again, we are having, so far, the 3 that I've dealt with have all been the same ownership, and they have been fantastic with emailing me staff lists, completing their follow-up interview tools themselves, and turning things around and communicating with us well. Again, when we educate, when we talk to people as from that perspective of educating and wanting to do and provide whatever we can to make the situation better, we're having good response. But unfortunately, we're also having some tragedy with that. So I just wanted to alert the board that is in the paper, and that is what's going on there. We continue to work very closely with the police and the fire departments, the town management. We are on a call every morning. The town administrator, the superintendent, the chiefs, DPW, the assistant town administrator, myself, our nurse, and we're all working as hard as we can to just make sure that there's a strong coordinated response to this thing from any angle that we can hit it from. And that is about it, I think, for me.
Thank you. Thank you. I'd like to make a motion to adjourn the meeting at 4:17, April 24th.
Second.
All those in favor? Aye. And LeBlanc? Aye. Yes.
Mills, aye.
Nice, aye.
Wrong
All right.
order.
I'll never get it right. Thank you, guys.
Thank you.
Thank you.
Have a good weekend. Be safe.
Can someone please say circle gets a square?
Circle gets clear.
All right, goodbye.
See you later.
See ya.